guys. Want to make a video for week 12, but before I start, apologize for week 11. I'm not sure where the video went. I made a video, guys, for you guys, and it's not gone. It's gone. I'm not sure what happened, so apologize for that. So for week 12, since we're already in week 12, I just kind of want to discuss a little bit about this topic this week. As you see, if you've opened up the next case study, that it's not discussing a specific patient, but it's more questions. And the questions really center on the issues that we have in our country today on addiction. The questions deal with not only the physiological aspects of addiction, but the psychological aspects, and also to some of the genetic factors, some of the other areas that we see in addiction, like gambling. Gambling is an issue that we see. So I kind of just want to take a moment to talk about it for just a second. I've been teaching for a while, and I have so many students every semester that come to my office and that ask me questions about addiction. It's either I think I have a friend who might have a problem, I might have a problem, a parent might have a problem, so that tells me how pervasive addiction is. I think it just it affects everybody. Everyone knows someone, if it's indirectly through a friend of a friend, or it's direct, and because you see it in our society every single day. So much of the opioid overuse and the fentanyl issues that you hear about, and how many people died last year of fentanyl overuse, and then of course how many people are dying of opioid addiction every single day. So I just want to take a step back and kind of discuss it all, and a little bit about my experience with addiction, because it is so important to have those conversations. The second year of my master's degree, when you're in clinical and counseling psychology, you start to do your practicums and your internship. So the first year is just really taking all the courses. They're preparing you to work with people, and then the second year you have to decide as a cohort where you want to go. And I was fortunate to have many options when I was in my program. You could do outpatient facility. We have a couple of outpatient facilities, and we actually had a hospital, a psychiatric hospital, that was mainly for children and adolescents. And most of my classmates and my cohort, they went straight for the outpatient. I'm like, all right, chickens. And because I thought that I was I was still an animal trainer at the time. I was actually still training dolphins at the time, but I had also worked at a zoo, so I had all this experience with all these animals that wanted to kill me every day. I thought, I'll go to the hospital. Maybe I can, if I can handle tigers, I could probably maybe handle the psychiatric facility. So I was there the second week. One of the therapists and counselors came up to me and he said, would you like to attend my addictions group, my chemical dependency and addictions group? And I said, well, I'm really not interested in addictions. That's not what I'm going more, towards developmental disorders. I had a huge interest in autism. That's, my background. And he said, Robin, addiction is pervasive. It's everywhere. It doesn't matter if you want to work with some specific population, children, adolescents, adults. It's everywhere. And I thought about it, and I decided, I'm going to take it up, because how often you get the opportunities, to see the different populations and see how therapists actually work with certain populations. And I have to say, I'm so glad that I did, because he was right. Not only were the patients in his group, but many of the patients were in the afternoon therapy groups that were just the traditional type therapy groups, but it was a wealth of experience. And that's what I say to students who are thinking about majoring in psychology. If you go into clinical and counseling, and if anybody says, hey, you want to come observe my groups, you need to do it. It's just a perfect opportunity to see how therapists in different professions deal with certain populations. And he was actually a CAP. Now, I don't know if you've ever heard of a CAP, but that's a certified addictions professional, and they go extra credit hours after their masters to be certified in addiction. They are professionals. And it is amazing the amount of training and what they do and the experience, and it's just a wealth of knowledge to gain from listening to them and how they interact and how they develop their therapy groups from an individual to group. So it ended up, having that experience, and it paid off, because when I was an intern, a licensing intern, at the partial psychiatric hospital where I was an intern, they had a chemical dependency program. And again, they had a CAP that was there, and I had the opportunity to facilitate those groups, co-facilitate those groups, really get involved with the entire process. So when I look back at all my experience with addiction, where I started from doing my practicums was a child and adolescent facility, and where we did the chemical dependency program when I was a licensing intern was mainly adults. And I didn't realize it till I started teaching. I saw the entire pathway of addiction, from children starting in addiction and using drugs, to adolescents, to young people, to adults. I saw the entire pathway. And you have to kind of think of addiction, just like with alcoholism. It's up and down. People thought, if you start here, it's just going to go up. It's up and down with addiction. And that's what I learned by having the opportunity to watch the verbalization, the interaction with kids to adolescents, and then how drugs have affected these individuals as they were adults. So it was an important kind of therapeutic life lesson as someone going into the field. So here's some of the things I want to just mention to you, as you're going through these questions. So let me kind of just discuss this. First of all, look at the social influences of addiction. It is so cultural. I mean, name an occasion or an event where alcohol is not present. It's everywhere in everything that we do. Even now at kids' birthday parties, some of you are probably now thinking, just by me asking that question, you're probably thinking of all the occasions. So there's a huge cultural, social influence, and it's not just here in the United States, it's other places as well. And you have those social influences, that affect us and our personalities as we're developing. The next thing is the emotional and psychological influence. It may start off as a social influence. You may go to a party. They may say, hey, would you like a cocktail? In many cultures, having cocktails before dinner, wine with dinner. I have a friend from Spain, and she was mentioning that they have cognac after dinner because it's, how they, it kind of settles your stomach. So you see all these social influences with alcohol. I'll just stay with alcohol. But also, too, it can become emotional and psychological. How many times have we heard, someone say, and we didn't think about it, oh, you just need to go have a drink. Let's go get a glass of wine and talk about it. Usually in a response to some emotional distress or some type of psychological distress. So what can turn out to be social influences can also turn out to be emotional and psychological influences for that need. The next thing is the substance abuse. If somebody realizes that, I'm starting to use alcohol too much as an emotional and psychological response to everything that's happening, are they cognizant? Can they stop and go, okay, I need to step back. I need to kind of, work on my life just a little bit. Or do they build up that need? So, if somebody has a DUI, that's an abuse situation. And nowadays that DUIs are extremely costly, very, very costly, and it can ruin, people's lives. So when you get to that social influence and that emotional and psychological, influence, now is it becoming an abuse type of situation. And there is a difference between wanting to have a glass of wine and needing to have a glass of wine. So even the verbalization can be very influential. Now, for some people, though, it has a mood altering effect. Now we're starting to kind of fall out of the abuse, and now we're looking into maybe a dependence type of situation. I get asked the question: is it genetic? Is it a predisposition? And we've discussed this before. Other vulnerabilities. Having one parent that's an alcoholic, is that a higher chance of genetic vulnerability to becoming an alcoholic? And we have pleasure centers in our brain. You've probably heard of the addictive personality. For some people, it's very pleasurable. It really affects, pleasurable centers in the frontal lobe. And so you can see that physiological addiction that can happen. It has a very high mood altering effect. And that goes with other drugs as well. Some people can use a drug, they're prescribed maybe, painkillers, and they take the painkillers as prescribed, and when the prescription's up, they go about their life, it's not a problem. But for some individuals who may have that genetic vulnerability, the brain is like, wow, that was amazing, let's keep taking that. So you can see at that point where we're starting to shift a little bit from one side of the abuse, and then we're switching in now to possible dependence. So you think about the genetics, and also to prolonged use. If you're continuing to use and you're prolonging the use, one prescription after another, if it's a pain situation, then now we're maybe going to a dependence. And when you think about a dependence, do you need more and more of the drug to get the same effect? If you start off with a 6-pack and now you need a keg, that's becoming you're building up a tolerance. And I will say, there are some drugs out there that have a very high addictive, rate, very highly addictive, 1 or 2 uses, and the brain is like, wow, that was amazing. And so you have to think about, the different types of drugs when you're getting to that level. If you're starting to have withdrawals, if you're having sweats, you're shaking, you're having memory loss, this is a progression. Now you're getting into a substance dependence, paradigm, where this is now going down a path that may cause a lot of problems in the future. One of the things that we used to do in the hospital was, do an assessment. Is it starting to affect your job and your occupation? Are you finding that I used to ask patients, what is that drug doing for you that you can't do without? What is that drug doing for you that it's the only way for you to cope? So now can you see this psychological effect? You can withdraw someone, you can put them in detox, but if there's a psychological need, they're going to go right back to it. So you can see that addiction is this progression, and for some people, they never thought about it before. It could be that one medication. It could be, just the social influence, the social drinking. It could be a drug that they wanted to take because it was, peer pressure, and they wanted to be part of a group. There's so many variables into addiction. So this case study is a little bit different. I wanted to focus more on the issues of the need, of physiological need, psychological need, having that parent and parental influences. That person that grew up in a home where they have an alcoholic parent. Maybe they had both parents were alcoholic. How does that parenting, a parent who is an alcoholic parent's different than a non-alcoholic parent? We do the studies. So just a little bit different, just to kind of get you to think about addiction and how it works. It's in our news every single day. We hear more about overdosing, even where we are in the state of Florida. Worldwide, how many people died of overdosing last year on opioids and fentanyl. So it's an important area, and again, it's pervasive. And many times, just going back to the alcoholism, it has shown a comorbidity that many alcoholics also meet a criteria for depression as well. And maybe they were depressed and used alcohol as a way to self-medicate, and now it just becomes that emotional and psychological influence, that need. So, good topic, and it's something that needs to be discussed. So kind of go through those questions. I'm also going to start with your Ted Bundy. I hope you enjoyed profiling Ted Bundy. I'm curious to see what you said about him. In my in-class abnormal psychology class, and it was an opportunity. They picked different serial killers, but there was a couple that picked Ted Bundy. It's like we reinvent him every 10 years. It's just interesting how, there's another movie about him, or they're doing some type of special. He just seems, it's like every generation they're reinventing Ted Bundy. He's kind of like the poster child for our sociopaths. So I'll be interested in reading your responses, and have a good rest of the week. Bye.